The Meadows Outpatient Center is an 8-week intensive outpatient program where we have the possibility of a dual diagnosis. So we treat addiction, we treat trauma, we treat depression and all the mental health diagnoses.
So many people are in such need, and the Meadows model of care in particular uniquely addresses needs that other programs may not. Making the Meadows model of care and treatment accessible to people regardless of their circumstances is a big part of the vision of the Meadows.
During that 8 weeks, they're going to get group therapy that happens Monday through Thursday each week. As a part of that as well, we have trauma-informed yoga. We do have art therapy with outside therapists that are both artists and therapists, so it actually is art therapy. We also incorporate Friday programming, so even though Fridays are not mandatory per se, we do incorporate things like Qigong, acupuncture, and again trauma yoga, so that patients are able to access different forms of emotional regulation.
The Meadows, we really understand what trauma is. We're not talking about only the big T trauma. We're talking about also the little t trauma, the relational trauma, the little things that happen in your life that people not even aware of because it happens all the time. The brain spot, the neurofeedback is to help them to work with their body and work with their brain to really bring back to the normalcy of it so people will feel relief of those trauma symptoms or reactivity to things. They feel calmer, they feel more centered. Our clinicians get so many trainings. We're training in psychodrama. Most of our therapists are EMDR trained.
For people who aren't able to come to the in-person locations, we do have a separate virtual Meadows outpatient program. They are making that available in many different states around the country. And if somebody's at home with a sick child, it's possible they could also join the group still, so you could have a combination in-person and virtual group also. So it's been tremendously advantageous for patients and their family members.
Why it's so important that the virtual IOP model the in-person IOP is that we want to make sure that every patient gets the same exact treatment, the high-end treatment that we have. We also want to make sure that if you have trauma and you're unable to go to an in-person facility, that you still get the same treatment, that you'll be able to get treated for your substance abuse addiction, behavioral addiction, trauma. We don't want anyone to feel left out.
The hope, I think, that is a part of the recovery journey is a huge part of what I think we bring to the table, and the ability to provide for someone just a sense of knowing that I can do this.